There's also, I've been doing a lot more what we call endoscopic surgery. So kind of you think of like a sports medicine surgeon would do a knee scope or a shoulder scope. So I can go in, surgeons go in through a 2 centimeter incision.
It's so little.
We just use 2 of them, and we can literally go in, clean some of the muscle off the bone, and we can go in and clean out the arthritis. And then we have special tools where we can go in, we can move the nerve sac over, we can take out a disc herniation and kind of just pluck it out very elegantly, get the pressure out the nerve, and then it's usually just a couple stitches and close it up.
Would that be, I would assume that's outpatient?
Yes,
then.
so that's outpatient.
That's amazing. It's hard to imagine when you talk about an incision that little. I mean, obviously, the patient's glad to hear it's not going to be like a, a 6-inch incision, but is that done robotically then? Is that?
So that's a great question. So when we do those types of surgeries, that's not robotic because we're actively kind of doing everything there. The robotics that we use today is more for placing the implants. So if we're going to place screws throughout the spine, we can do a scan of the spine, and then know exactly where in space then our instruments are. And so through small incisions, we can go in, we can put the screws, we can retract things, and then we can literally in space, I can literally take an instrument and I can follow it all over the screen because it can see it in space. So then through a small incision, I can go ahead, this far down into the body and scrape out the cartilage and take out things that we need to get out of there, and then we can put our cages or our implants in there through much smaller incisions. So it still allows us to do surgery with less destruction, less disruption of the muscle and all that in a much very precise way. Which becomes a very safe surgery for the patient.
I was going to say, that's amazing. Just even in my lifetime, I remember people, when I was younger, older relatives having hip and spine surgery and things like that. And it was a huge deal. I mean, they were in the hospital for over a week a lot of times, It just doesn't happen anymore.
Oh yeah, even, I've been in practice now for 13 years, and it was routine for a one-level fusion to stay 3 days, and now 90% of them are home within the next day. So, the things that we're able to do now it's amazing.